If you've had your gallbladder removed, or your doctor is telling you that you need it out right now, there's something almost nobody's explaining to you before you sign that consent form. Removing this organ doesn't end the story. For a huge number of people, it's actually where a whole new set of problems quietly begins. Digestive issues that show up years later. Vitamin deficiency, as nobody connects to the surgery. Shoulder pain that sends people to a chiropractor instead of back to their GI doctor. By the end of this video, you'll understand exactly why that happens, what your body is missing without this organ, and the practical steps people use to feel normal again. So stay with me, because the most useful part, the part almost no surgeon has time to walk you through, is coming up. Let's start with the numbers, because they're bigger than most people realize. Somewhere around 700,000 people in the United States alone have their gallbladder taken out every single year. That makes it one of the most common surgeries performed in this country. And in the vast majority of those cases, patients are told the same reassuring line. You don't really need it. It's not going to cause problems. Life goes on exactly as before. What almost nobody hears is the other side of that conversation, the informed part of informed consent. Nobody sits down and explains what your body actually loses when this organ is gone, or what you can do to compensate for it. That gap in the conversation is exactly what we're going to close today. So let's back up and talk about what the gallbladder is actually doing in there, because most people genuinely don't know. It's a small pouch tucked underneath your liver, and its entire job is to store and concentrate bile. Bile itself isn't made in the gallbladder. That's a common mix-up. Bile is manufactured by the liver, and it travels down a small duct into the gallbladder, where it gets concentrated and held in reserve. Then, the moment you eat something with fat in it, the gallbladder squeezes and releases that concentrated bile into your small intestine, where it goes to work breaking fats apart so your body can actually absorb them. And that's the part people underestimate. How much depends on that one squeeze. Without adequate bile hitting your gut at the right moment, fat doesn't just pass through undigested. You lose access to fatty acids, cholesterol your body actually needs in the right amounts. And this is the big one, the fat-soluble vitamins, A, D, E, and K. You also lose out on omega-3 fats, which do a lot of the heavy lifting when it comes to calming inflammation in the body. And here's something that surprises people. A lot of the protective plant compounds in your vegetables, things like curcumin from turmeric or the carotenoids in carrots and leafy greens, are fat-soluble too. Which means if your bile isn't flowing properly, you could be eating a beautifully balanced vegetable-packed diet and still not be absorbing the benefits, simply because the fat solubility puzzle piece is missing. But bile isn't just a fat digestion tool. It's doing several other jobs behind the scenes that rarely get mentioned. It's one of your body's main pathways for clearing out toxins, excess hormones like estrogen, and even things like pesticide residue. It's also your primary route for getting rid of surplus cholesterol. Bile literally carries it out of the body. On top of that, bile has antimicrobial properties. It helps keep the microbial population in your small intestine in check. When that balance tips the wrong way, you can end up with a condition called SIBO, small intestinal bacterial overgrowth, where bacteria that should be living further down in your colon creep upstream into the small intestine and start fermenting your food before you've had a chance to absorb it. The result? Bloating, gas, and discomfort that a lot of people just live with for years, never realizing bile is part of the picture. Now that we understand what's actually happening and what tends to make it worse, let's get into what genuinely works, starting with what to do right in this moment if stool is already stuck and you need relief. You don't need something designed to take 2 full days working its way through your entire digestive system. What you need is something that pulls water directly to where the actual blockage already sits, right at the exit. One well-established option is milk of magnesia, also known as magnesium hydroxide, an osmotic laxative that draws water directly into the stool rather than forcing contractions further up the digestive tract. As always, follow the dosing instructions printed directly on the product. Label and use the measuring cup provided with the product rather than guessing with a random kitchen spoon. Most people notice results within roughly 30 minutes to 6 hours of taking it, typically most effective when taken in the evening. A few genuinely important warnings apply here. This option should generally be avoided. If you have kidney disease, since your kidneys are responsible for clearing magnesium from your system, and impaired kidney function can allow it to build up to levels that become genuinely dangerous. Extra caution is warranted with certain heart conditions or with medications that affect your body's electrolyte balance. And if you're currently taking any prescription medications, it's worth checking with your doctor or pharmacist first, since magnesium-based products can affect how certain medications are absorbed into your system. If you're looking for something more immediately targeted, a glycerin suppository is a second widely available option. Inserted. Directly into the rectum, it works right at the source of the problem, drawing water into the e-stool while gently stimulating the rectal wall to encourage movement. Most people see results within about 15 to 30 minutes, and it's available over the counter at essentially any pharmacy without a prescription. What's worth avoiding, especially as a regular ongoing habit, are strong stimulant laxatives like senna or bisacodyl. These work by irritating the colon into forceful contractions, which causes cramping and urgency, and over time, regular use can lead to your colon becoming dependent on that stimulation to function at all, which is the opposite of what you actually want long term. But here's the part that most people completely miss, even when they've picked exactly the right product. You can do everything else correctly and still end up sitting there for 20 frustrating minutes with nothing happening, simply because your body is positioned wrong the entire time. Remember that loop we talked about earlier, the puborectalis, the muscle that creates the bend in the hose? Sitting upright on a standard modern toilet actually helps maintain that bend rather than releasing it. In that position, you're essentially asking stool to travel through a kink that hasn't been straightened out. The fix here takes less than a minute to set up, and it's remarkably simple. Take a small footstool, somewhere around 6 to 9 inches high, and place it directly in front of the toilet so your feet can rest comfortably on top of it. This raises your knees up above the level of your hips. From there, lean your torso forward slightly and rest your elbows on your knees. That's the entire physical adjustment required. Knees above hips, body leaning forward, and the bend in that internal hose straightens out, opening the path that was blocked before. The second half of this technique matters just as much as the positioning itself. Relax your belly completely and let it push gently outward, rather than pulling it in or tensing it the way most of us instinctively do. Then take a slow inhale through your nose, letting your belly expand fully as you breathe in, followed by a long, slow exhale through your mouth. On that exhale, consciously let go. You're not straining in this moment, you are releasing. I know this goes directly against what most of us were taught growing up, which was to hold your breath and bear down hard. In reality, that old advice tenses the pelvic floor and seals the exit shut even tighter. Slow belly breathing, by contrast, sends those exact same muscles the opposite signal, an instruction to relax rather than clench. Now that we've covered what to do in the moment, let's shift from emergency relief to genuine long-term prevention. Because the real goal here isn't reaching for a laxative every single week for the rest of your life. The real goal is stopping stool from hardening at the exit in the first place. So you rarely find yourself stuck like this at all. It usually takes time, and it usually has an identifiable cause behind it. It's rarely just bad luck. Years before anyone connects the dots. Now here's where this gets really important, because this is the part that almost never comes up before surgery. Taking the gallbladder out does not fix any of that underlying chemistry. Think about what the surgery actually does. It removes the storage, sac. It does nothing to correct why your bile was too concentrated with cholesterol, why your estrogen was elevated, why your insulin was high, or why your thyroid was T-drips continuously and passively into the small intestine, instead of arriving in hitting the intestine at the wrong times and the wrong amounts, sometimes too much, reaching the colon, sometimes too little available when you actually need it for a meal. And that mismatch is where most post-gallbladder removal complaints come from. Let's talk about too much bile reaching the lower gut first, because this is an extremely common complaint, and most people are never told the why behind it. When excess bile acids reach the colon, they act almost like a mild laxative, pulling water into the bowel and speeding everything up. That's why designed to bind bile acids and reduce this effect. But like most medications, it comes with its own list of side effects, so it's worth... Now flip it around. What does it look like when you don't have enough active bile? Reaching your gut at the right moments? The signs are different, and honestly a bit sneakier because they build slowly instead of announcing themselves. Constipation is a big one. Stool that's noticeably pale or light-colored is another classic sign, because bile is actually what gives stool its normal brown color. When bile is scarce, that pigment is vitamin D, vitamin E, and vitamin K. If your bile output is inconsistent, your absorption of these vitamins can quietly slide for years without anyone connecting it back to a surgery that happened a decade earlier. So what can actually be done about it? One option people explore, always under a doctor's guidance, is supplementing with X-bile, essentially replacing what your gallbladder used to release automatically at mealtime. The idea is to take it alongside meals containing fat, so it's available exactly when your body needs it to break the fat down. Dosage tends to vary quite a bit from person to person. Some people find a small amount is plenty, others need more. So this is genuinely a work with your doctor to fine-tune it situation, rather than a one-size-fits-all number. There's also a specific bile acid called TUDCA that's gotten attention for supporting nerve tissue and mitochondrial function, and some people use it specifically because it appears to help thin out thickened, sludgy bile. Digestion isn't just one organ working in isolation. Your liver, gallbladder, and pancreas all work as a coordinated team. When the gallbladder is removed, the pancreas often has to compensate and work harder to pick up slack elsewhere in the fat digestion process. Over time, that added strain can create its own downstream problems, sometimes producing referred pain that shows up on the left side of the body rather than the right, since that's where the pancreatic duct crosses over. In cases where lipase output is genuinely low, a pancreatic enzyme supplement taken with meals can help pick up where digestion is falling short. Now, let's get to the piece of this puzzle that deserves way more attention than it gets: choline. This nutrient rarely makes headlines, but it plays a surprisingly central role in gallbladder and liver health. Choline helps keep cholesterol from crystallizing in the first place, which, remember, is the very first step in the whole sludge-to-stone pipeline we talked about earlier. It's also protective against fatty liver disease because it helps your liver actually process and export fat properly instead of letting it accumulate. Here's the uncomfortable part. Most people are not getting nearly enough of it. Choline is concentrated in foods like egg yolks, seafood, and organ meats like liver, foods that, frankly, a lot of people avoid these days out of misplaced cholesterol fears. For most people, eggs end up being the main practical source, and even then, 2 eggs typically supply less than 2/3 of a day's requirement. On top of that dietary gap, research suggests roughly half the population carries a genetic variation that increases their choline needs even further, layered on top of the vast majority of people who already aren't hitting adequate intake through food. Put those two numbers together, and you start to understand why gallbladder issues are so widespread. A huge percentage of the population is walking around with a quiet, invisible vulnerability nobody ever mentions to them. Having a genetic predisposition doesn't guarantee you'll develop a problem. It simply means your body's threshold for choline is higher than average, so you have to be more intentional about reaching it. And certain lifestyle factors push that requirement even higher. Endurance exercise, high stress, regular alcohol consumption, and a diet heavy in processed food all increase how much choline your body burns through. If several OF those apply to you, it's worth paying particular attention to getting enough through diet, and if needed, through supplementation, ideally with guidance from a knowledgeable practitioner. So let's pull all of this together, because by now you can probably see the through line connecting everything we've covered. A gallbladder problem is almost never really about the gallbladder in isolation. It's about the chemistry feeding into it: cholesterol concentration, estrogen balance, insulin, sensitivity, thyroid output, and choline status. Surgery removes the organ that was struggling to keep up with that chemistry, but it leaves every one of those underlying drivers exactly where they were. That's precisely why so many people report new or ongoing digestive symptoms years after their surgery: bloating, irregular bowel habits, right-sided discomfort, or slow-building nutrient deficiencies that nobody bothers to trace back to a procedure that happened a decade earlier. If you're someone who still has your gallbladder and you're trying to avoid ever needing this surgery, the takeaway is fairly clear. Don't fear dietary fat outright. Keep an eye on blood sugar and insulin levels, pay attention to fiber intake to support healthy bile clearance, and make sure choline-rich foods are actually showing up on your plate regularly. And if you've already had the surgery, know that the symptoms you might be dealing with right now, the diarrhea, the constipation, the strange right shoulder ache, the fatigue that comes with fat-soluble vitamin shortfalls, these aren't things you simply have to accept as the new normal. There are practical, targeted ways to support digestion without the organ that used to handle part of that job automatically, from fiber choices to enzyme support to working with a knowledgeable practitioner on bile replacement. None of this is meant to replace a conversation with your own doctor, especially if you're dealing with ongoing pain, unexplained weight loss, or symptoms that are getting worse rather than better. Those absolutely deserve proper medical evaluation. But armed with this information, you're in a much stronger position to have that conversation, ask sharper questions, and understand what your body might actually be asking for. If this connected some dots for you, maybe explained a symptom you've been living with for years without an answer, that's exactly why this kind of information needs to get in front of more people before they end up on an operating table without ever hearing it. Share it with someone who's had their gallbladder removed and still hasn't figured out why their digestion never quite went back. Keto normal. And if you want to keep learning how your body's systems connect together in ways your doctor's 10-minute appointment never has time to cover, stick around. There's a lot more where this came from.